Hello, I'm Dr. Fred Venditti, the Hospital General Director here at Albany Medical Center. I'm joined today by Sarah Elmendorf, our Senior Epidemiologist and one of the Senior Infectious Disease Specialists here in the Capital Region. We're going to bring you the update on COVID. Let me start by saying, actually, this is our 100th episode of these updates. Dr. McKenna, unfortunately, couldn't be here for this 100th episode, but Dr. Elmendorf is a wonderful stand-in for him.
It's a privilege to be here. Thank you.
Thank you for joining us, Sarah. Let me start with something non-COVID. Over the last 24 hours, we've had a network downtime. We had some issues with, and I'm going to get out of my realm here very quickly, with our switches through which all of our network traffic flows. Everyone's been working very hard to bring it up, and I think just before we came up here, most of the clinical systems were brought live. Based on conversations with multiple experts, both inside and outside the organization, we do not feel that this was a cyber attack. Those switches had been installed about 2 weeks ago, and we feel it was something internal to the organization. But I want to thank all the staff that worked very hard over the last 24 hours with very little sleep, both the incident command staff, IT, the clinical staff working. And I want to also throw a shout out to St. Peter's Hospital. We went on diversion, Sarah, for 9 hours yesterday. So St. Peter's took about 20 EMS diversions from us to allow us to sort of catch our breath clinically. So thank you, St. Peter's, for doing that. And also, they sent about 20 cell phones to us for communication because our phones were down as well. So thank you. So with that, let's go to the numbers. Here's the first slide, which has the inpatient admissions for the Capital Region. And you can see that we continue to have growth in hospitalizations. We're at 129 hospitalizations as of the 10th on this slide. We continue to have our weekly call with the other hospitals. Sarah, you participate in that call. And the growth in cases is really spread across the whole region. Here's the next slide, which is the situation here at Albany Medical Center. And today we're at 28 inpatients. 9 of those inpatients are in intensive care, and only 2 of them are ventilated. Sarah, we've sort of seen a little shift in the kinds of patients that are sick with COVID. Isn't that true?
Yes, it's true. We are seeing much more COVID than we had seen in the past in the community. And the patients that we are seeing admitted to the hospital are not as ill as they were in March and April when we first started seeing these patients.
If you had to speculate, what do you think that's due to?
We've been having discussions about that for months now as we've noticed this trend. And perhaps it's being exposed to a less amount of virus. It's possible that the virus itself has mutated. It appears that COVID is very transmissible. The virus is SARS-CoV-2, and it appears that that is very transmissible between patient or individual to individual. So that may be contributing to some of this. It is not thought to be associated with a more virulent infection, so that may be a contribution as well.
Very interesting. So here's the third graphic, which just has the admissions and discharges. And again, visually you can see that we've seen pretty significant growth in admissions over the last couple of weeks. So Sarah, I said you're our senior epidemiologist. You've actually been in this role for many years. I won't say exactly how many, but many years.
Yes.
Tell us a little bit about epidemiology. What's the role of epidemiology here in the hospital?
Well, I trained as an infectious disease specialist, and the link between infectious disease and epidemiology is very tight. And I work with a wonderful team in the Department of Epidemiology, and everyone is very invested in what epidemiologists do. So our role is primarily to look at infections, to try to prevent infections, to recognize infections when they first occur. We do a lot of surveillance of infections, everything from streptococcus, for example, or different types of pneumonia. We look at different infections that we may see in surgical populations, and we work very closely with the health departments. So we work with the Department of Health in New York State, we work with regional health departments, and we also collaborate with the other hospitals, which has been very helpful during the COVID outbreak.
That's been very important
Yes.
In the past now 7 or 8 months with COVID. So Sarah, tell us a little bit more about EPI's involvement in COVID.
So that has been a very important part of our role since we identified the first case, which I believe in Albany was in March of 2020. We first heard about COVID, of course, last January, occurring in Wuhan, and then we saw it slowly arrive here in Albany in mid-March. So we are assisting in early recognition of cases, identifying cases of COVID infection or SARS-CoV-2 infection, and we also assist in preventing transmission of infection and how we isolate patients and what types of strategies we can use to keep staff and patients safe. So it's really early recognition of the virus and the clinical presentation of the virus, tracking the virus in the community, in the hospitals, in the region, discussing it with all of the health departments. There's very close collaboration between all of the health departments, and certainly working within our own community.
I think it's fair to say that our epidemiology group and our infection protectionists are very well respected within the community and by the Department of Health. Mm-hmm. At times, the Department of Health has actually reached out to you, Sarah, right, for advice on how to handle certain issues. So Sarah, what's the most important thing you want to convey to the staff and the community watching this video about prevention?
So we are seeing a change in how SARS-CoV-2 infection is occurring. And early in the pandemic, we saw people who were really sick and quite symptomatic when they had SARS-CoV-2 infection or COVID. We are seeing now that many people have very few symptoms, as a matter of fact, can be asymptomatic. And this has evolved with our knowledge of the pandemic. Initially, we didn't think this happened. We thought people were only symptomatic when they had SARS-CoV-2 infection. But now we know that as many as 40 to 60% of individuals may be asymptomatic, so not even know that they have it. So that's why it is so important to use the PPE or our personal protective equipment early and consistently. And so strategies such as wearing a mask all the time, particularly when dealing with patients and others, because you can't rely on people having symptoms. Wearing eye protection is huge. We know that the virus is transmitted by droplets that are infected from the respiratory tract, and if they contact the eyes, the nose, or mouth, the virus can be transmitted in that way. So it's very important to protect your eyes and to wear a face mask. And then, of course, there's the social distancing, so staying more than 6 feet apart. So those are the 3 key strategies in terms of trying to protect yourself from COVID.
And Sarah, I'd throw one more in that my mother drilled into me when I was a kid. Wash your hands, wash your hands, wash your hands.
Yes, absolutely. That's key. Yes, hand hygiene.
So Sarah, let's flip to one more topic about COVID, and that's the vaccine.
Yes.
So maybe tell us a little bit about vaccines, how they work, how the Pfizer vaccine works.
Okay. So the Pfizer vaccine is quite unique. We've not seen a vaccine like this delivered to the community or to the population. Basically, the Pfizer vaccine is an mRNA vaccine, and it takes mRNA from the virus, and that is what is injected into, it's inert, that's what is injected into humans. And then the human cells pick up the mRNA and then use it to develop viral protein. And so when the host cell develops viral protein, it stimulates an antibody response. And so once you have antibody, as a result of having been exposed to the viral protein, we're hoping that immunity will occur. Unfortunately, it will require 2 shots with the Pfizer vaccine, so that's unlike some of the other vaccines, although we do need multiple vaccines to protect against viruses such as hepatitis B and hepatitis A, so it's not that unusual. But it is using mRNA, which is an unusual and very exciting approach.
So Sarah, the virus has DNA or genes. They get transcribed to RNA.
Correct.
The RNA then is used as a template to build the proteins that new virus particles are made from.
Absolutely.
So instead of the end result, the virus particles injected into the body to develop immunity. It's a step before that.
Yes.
That messenger RNA.
Right.
Very
so
interesting.
It's an RNA virus, and so they use the mRNA.
mRNA.
Yes, and it
Terrific.
develops proteins. Yeah, so it's quite exciting technology.
Yeah. Well, more to come on that. We should be hearing more about that vaccine later
Yes.
this month.
And the news is that it looks quite protective.
Yes.
So that 90% of people in the early studies are immune.
That's great.
Yeah.
Okay. Well, so let me finish up on one other topic today, and that's really about yesterday. Yesterday was Veterans Day, very important day recognizing the sacrifice that men and women in this country have made for us,
Yes.
for our freedoms.
Yes.
We actually had volunteers yesterday walking through the hospital distributing cards and flags to veterans who were hospitalized. So really terrific that they were recognized that way. So thank you to those volunteers for having done that. So
Yes,
really
very
good.
special day.
Very special day. So Sarah, I think that'll do it. Thank you
Great.
very much for being my co-host.
Thank you. Thank you for inviting me.
I will invite you back again.
Thank
So
you.
with that, that's it here from Albany Med. As my good colleague, Dr. McKenna would say, take care of yourself and take care of each other.